This is Dr. John Carlton with Wave Chiropractic in Bradenton. I have been having a lot of questions about vertigo, especially with all these storms coming through here, pressure changes and stuff like that. So I just want to go over a little bit about what vertigo is, the different kinds, and what we do for that. So there are 4 different kinds of vertigo out there: positional wise, Meniere's disease, vestibular neuritis, and labyrinthitis. A lot of those are from inner ear infections, and what we can do with those, we actually will do a complete evaluation to find out exactly what kind of vertigo you do have. The most common one is the non-positional vertigo type of disease, also known as crystals floating around in the inner ear. A lot of people will go to other doctors and get medications that sometimes don't help. Sometimes they just minimize the effects of those. But what we do here is we will evaluate you. I'm very proficient in what's called Epley maneuver and testing. The biggest difference between that and other people is I actually check the upper cervical for the neurological component that controls the inner ear. And then we basically will put you in different positions, adjust you in those positions. And typically the patients will see almost immediate type of relief. Sometimes it takes a few visits to do that. I also give homework to do for those patients. There's different kind of exercises that they can do at home in the comfort of their bedroom, and they will actually help with putting those crystals back into more of a neutral position. So that's the most common ones that we see here, but the other ones are a little bit more involved. And those are the ones that we will basically refer out to medical doctors or an ENT to make sure that there's nothing else going on in the inner ear, whether it be position-wise, whether it be infection-wise, whether it be basically a malformation in the inner ear. Sometimes we have to do surgery. Obviously, I don't do that, but we refer out to that. So there is definitely a multifaceted type of approach when you're dealing with vertigo. So we actually have the patient come in, we evaluate them thoroughly. We do some imaging as well in the upper cervical area, and then we actually will do treatment on that first day. So if you are experiencing vertigo, any kind of vertigo, we can definitely help with that. So check us out on Wave Chiropractic in Bradenton.